Hello my dear future nursing officers, welcome back to my channel. Let's start first MCQ. Which test can be detect for urine bile salt? Option A, Hayes test. Option B, Benedict test. Option C, Fehling test. Option D, Smith test. Answer is option A, Hayes test is correct answer. For detecting bile pigments, we can use Smith test. Next MCQ. Stiffness occur to the body after death is known as option A, Allor mortis, option B, liver mortis, option C, rigor mortis, option D, tardive spot. Answer is option C, rigor mortis is stiffness occurred to the body after death. Next question. Best position for a client in hypovolemic shock is option A, knee chest position, option B, Trendelenburg position, option C, Fowler's position, option D, lateral position. Answer is option B, Trendelenburg position we can use in hypovolemic shock, means head lower than the legs. Next MCQ. 500 ml of IV fluid need to be administered over 5 hours. Factor is 20. Calculate drops per minute. Option A, 32 drops per minute. Option B, 33 drops per minute. Option C, 34 drops per minute. Option D, 35 drops per minute. Answer is option B, 33 drops per minute. Now we will see how to calculate in drop factor. Formula is desired dose into drop factor divided by time into minute. So desired dose is 500 ml into drop factor is 20 divided by time in minute, means time is 5 hours into minute is 60. Answer will come 33 drops per minute. Move to next MCQ. Elevated specific gravity can be seen in option A, diabetes insipidus, option B, dehydration, option C, hypovolemia, option D, hypokalemia. Answer is option B, dehydration is correct answer. Move to next MCQ. Which of the following colored contained must be used for discarding human anatomical waste in hospital? Option A, yellow, option B, red, option C, blue, option D, black. Answer is option A, yellow color. So in bio-waste hazards, there are 5 colors: yellow, red, blue, black or green and white. In yellow dustbin, we can discard human anatomical waste and body fluids and moist cottons, etc. And red dustbin, we will discard plastic, syringes, saline bottles, etc. And in blue dustbin, we will discard in vials and black or green. So dustbin we will discard general waste materials, and white dustbin is puncture proof container. We will discard in that white container sharp items like needles and surgical blades, etc. Move to next MCQ. Cold calories test used to check the functioning of option A heart, option B brainstem, option C pons, option D hypothalamus. Answer is option B brainstem is we will use for cold calorie test to check functioning. Next MCQ. If a blood pressure curve is too narrow or wrapped too loosely, the blood pressure reading will be option A dependent on the examiner hearing acuity, option B difficult to hear because sound will be muffled, option C falsely low, option D falsely high. Answer is option D falsely high reading will show. Next MCQ. Movement of a body part away from the body midline is termed option A abduction, option B adduction, option C extension, option D pronation. Correct answer option A abduction is movement of a body part away from the body midline. Next, to avoid pulling the urinary catheter, nurse should tape the catheter on patients. Option A lower thigh, option B upper thigh, option C hind leg, option D foot. Answer is option B upper thigh is correct place to tape the catheter. Next MCQ. Position given to patient during sigmoidoscopy or colonoscopy is option A supine, option B prone, option C lithotomy, option D left lateral. Answer is option D left lateral position for sigmoidoscopy during procedure. Next MCQ. While measuring blood pressure from leg, coroscope sound is accumulated in option A axillary artery, option B brachial artery, option C femoral artery, option D ulnar. Answer is option C femoral artery is correct answer. Next MCQ. Normal duration for completing suctioning of the tracheostomy tube is option A 5 to 10 seconds, option B 10 to 20 seconds, option C 20 to 30 seconds, option D 30 to 40 seconds. Answer is option A 5 to 10 seconds for tracheostomy suctioning, not more than 10 seconds. Next MCQ. The risk of HIV infection after needle stick injury with HIV infected blood. Option A 1:50, option B 1:100, option C 1:200, option D 1:300. Answer is option D 1:300 is correct. Next MCQ. While giving enema, which height can be placed at? Option A 20 to 30 centimeters, option B 25 to 35 centimeters, option C 30 to 40 centimeters, option D 40 to 45 centimeters or 18 inches. Answer is option D 40 to 50 centimeters or 18 inches is correct. Next, air conduction and bone conduction is tested using which among the following test? Option A Weber test, option B Rins test, option C Romberg test. Option D. Allen test. Correct answer. Option B. Rinse test is tested for using air conduction and bone conduction, and Weber test is performed for sensorineural hearing loss, and Romberg test we will use in examine of neurological function for balance, and Allen's test we will use in to check the patency of the ulnar artery while taking ABG sample. Move to next MCQ. Discharge planning of the patient begins. Option A. When the physician orders for discharge. Option B. When patient starts showing positive response to treatment. Option C. At the time of initiation of treatment. Option D. At admission. Answer is option D. At admission. Next MCQ. Hypodermal injection commonly known as. Option A. Intradermal. Option B. Subcutaneous. Option C. Intravascular. Option D. Intramuscular. Answer is option B. Subcutaneous is correct answer. Next. The nursing officer Shika has to administer ear drop to an adult. How does the number of pulls the patient ear? Option A. Outward. Option B. Backward. Option C. Downward and backward. Option D. Upward and backward. We will see correct answer. Option D. Upward and backward used in adult, and downward and backward used in children's below 3 years of age. Move to next MCQ. The presence of an infection agent in an inanimate article or skin surface is called. Option A. Infestation. Option B. Pollution. Option C. Infection. Option D. Contamination. Correct answer. Option D. Contamination is correct answer. Next MCQ. The target cells of HIV virus in body are. Option A. Reproductive cells. Option B. White blood cells. Option C. Red blood cells. Option D. Nerve cells. Answer is option B. White blood cells. Next MCQ. What can be the maximum score for Glasgow Coma Scale for a fully conscious individual? Option A. 20. Option B. 5. Option C. 10. Option D. 15. Answer is option D. 15 is correct answer. Glasgow Coma Scale we will use in coma patients or unconscious patients. So minimum score is 3 and maximum score is 15. Move to next MCQ. The endocrine function of pancreas is performed by. Option A. Islets of Langerhans. Option B. Acinar cells, follicle cells. Option C. Islands of Langerhans. Option D. All of this above. Correct answer. Option A. Islets of Langerhans. Next MCQ. Which of the following are not the indicators of health? Option A. Health policy indicators. Option B. Healthcare delivery indicator. Option C. Utilization rates. Option D. Disease control. Answer is option C. Utilization rates. Remaining 3 answers are correct. Next MCQ. Which of the following is not to be done while preparing a patient for health assessment? Option A. Sleeping. Option B. Draping. Option C. Positioning. Option D. Emptying the bladder. Correct answer. Option A. Sleeping is correct answer. So, while preparing a patient for health assessment, we will perform draping, positioning and emptying the bladder. So, in this question they are asking not to be done. So, answer is sleeping. Next MCQ. Who discovered vaccine of rabies? Option A. Pasteur. Option B. Jenner. Option C. Alexander Fleming. Option D. Aristotle. Correct answer. Option A. Louis Pasteur is discovered vaccine of rabies and anthrax vaccine also. And Edward Jenner discovered is cowpox vaccine and smallpox vaccine. And Alexander Fleming discovered penicillin. And Aristotle is a father of modern science. Move to next MCQ. White lung disease is prevalent among the worker of option A. Flour industries. Option B. Cotton industries. Option C. Paper industries. Option D. Salt industries. Answer is option B. Cotton industries. Next MCQ. Virus of bird flu is also known as option A. NH51. Option B. HN61. Option C. H5N1. Option D. NH15. Correct answer. Option C. H5N1 correct. Next. Option basic C. Unit family is basic society unit in all is. Society. Option A. The disease Kala Hazar is spread by option C. A. Sandfly. Option B. None of the above. Option C. Correct answer. Housefly. Option D. Bed bugs. Answer is option A. Sandfly is spreads Kala Hazar disease. So, Kala Hazar disease is a vector-borne disease. Next MCQ. The best time of intrauterine device insertion is option A. Between 3 to 7 days of menstrual cycle. Option B. Before 3 to 7 days of cycle. Option C. Within 14 days of menstrual cycle. Option D. At time of delivery. We will see correct answer. Option A. Between 3 to 7 days of menstrual cycle, best time of IUD insertion. Next MCQ. The MTP Act came in the year of option A. 1971. Option B. 1974. Option C. 1987. Option D. 1983. Answer is option A. 1971 year the Medical Termination of Pregnancy Act came. Next MCQ. World AIDS Day is observed each year in option A. 8th December. Option B. 1st December. Option C. 1st November. Option D. 14th April. Correct answer. Option B. 1st December is World AIDS Day. Next MCQ. The Central Death and Birth Registration Act came into force on Option A. April 1970. Option B. March 1975. Option C. April 1959. Option D. June 1965. Answer is Option A. April 1970. Birth rates and death rates registered within 21 days. Next MCQ. National Program for Control of Blindness was launched in Option A. 1976. Option B. 1959. Option C. 1967. Option D. 1980. Correct answer. Option A. 1976 is National Program for Control of Blindness. Next MCQ. Mudaliar Committee is also known as Option A. Health Survey and Planning Committee. Option B. Health Survey and Develop Committee. Option C. Health Survey and Assessment Committee. Option D. None of this above. Answer is Option A. Health Survey and Planning Committee. Mudaliar Committee in the year of 1962. The headquarters of WHO is situated in Option A. Switzerland. Option B. Geneva. Option C. Rome. Option D. Italy. Correct answer. Option B. Geneva is correct answer. Next MCQ. What is the main source of transmitting the infection of chickenpox? Option A. Oropharyngeal secretion. Option B. Polluted water. Option C. Stool. Option D. By skin. Answer is Option A. Oropharyngeal secretion. So chickenpox caused by varicella zoster virus and human virus 3. An incubation period of chickenpox 14 to 16 days, wide 10 to 21 days. So in this chickenpox appears in 2 stages, pre-eruptive stage and eruptive stage. In this pre-eruptive stage, so we will see sudden mild moderate fever, malaise and shivering neck pain, and second eruptive stage. In this eruptive stage, we will see first sign of rash on trunk, next face, arm and legs. Move to next MCQ. What is the incubation period of chickenpox? Option A. 5 days. Option B. 10 days. Option C. 15 days. Option D. 20 days. Correct answer. Option C. 15 days is incubation period of chickenpox, as a wide 10 to 21 days. Next MCQ. MMR vaccine refers to Option A. Mumps, measles, rotavirus. Option B. Mumps, measles, rubella. Option C. Mumps, measles, rabies. Option D. Meningitis, measles, rotavirus. Correct answer. Option B. Mumps, measles, rubella is a MMR stance. So mumps causative organism is paramoxyvirus. It's a RNA family. Mumps incubation period is 2 to 4 weeks, around 18 days. So complications of architis, ovaritis, ophiritis, pancreatitis and hepatitis. and meningoencephalitis and myocarditis. And one more most important complication is sterility we will see in males. Next MCQ. Highest level of need according to Maslow's hierarchy. Option A, physiological. Option B, safety and security. Option C, love and belongings. Option D, self-actualization. Dear nursing officers, this question answer will give in comment box. Okay, my dear future nursing officers, as you know, we have a free mock test in our app and we are providing most important MCQs in community. Please go to community option in YouTube. In there is a important MCQs. Please visit and give answers. Okay, my dear future nursing officers, thank you for watching. If you like this video, please do subscribe, like, share and comment and click the bell icon. Thank you.